Dr. Moira Braylene is a urogynecologist with MSU Health Care. Welcome to Morning Blend, Doctor. Talk to our audience about what is a urogynecologist.
A urogynecologist is a specialist from either obstetrics and gynecology or urology that has gone on with additional training or has additional expertise in the diagnosis and treatment of pelvic floor disorders.
Talk about a pelvic floor disorder. What exactly does that encompass?
Pelvic floor disorders come from, it's a variety of different symptoms that come from the loss of normal support in the pelvis. So female organs are no longer supported like they were from weakened tissues.
So myths about pelvic floor disorders?
Well, probably the most common myth we hear is that it's a normal part of aging.
Yeah.
And while it's common as women get older, it's not normal, which leads to the second myth, which is I just have to live with it. When you don't need to live with it, there are certain treatments, multiple different treatments that can be offered to kind of help with your symptoms. And that leads to the last or the third myth, and that's that surgery is the only option, when surgery is usually the last option. We have multiple different treatments available that can help you with your symptoms.
And this is, we're talking about instances where women who talk about that they aren't able to fully have bladder control if they laugh or they cough or they sneeze, and that's something that, as you said, isn't just a normal part of aging. That's something that can be addressed with not just surgery, but what are some of the other options that can be explored to mitigate that problem?
Sure. The common disorders that you may or may not hear about are uterine prolapse or bladder prolapse, troubles urinating, urinary incontinence, and there are many non-surgical options that could be done, from physical therapy to different devices that could be placed in the vagina to kind of help with this support. And many women do very well with those treatments.
And it's not uncommon for this to be an issue, especially if someone has given birth, and it doesn't matter your age, it could be happening in your 20s, 30s, or later on in life. And again, it's not anything that you have to live with when there are so many options available. You can contact Dr. Moira Braylene at MSU Health Care. Some suggestions about the best way to get a hold of your office. Does it have to be a different doctor's referral because you're a specialist?
Well, I would recommend seeing your family doctor first because they have quite a few options available for you as well.
All right, Dr. Moira Braylene, thank you so much for joining us today. Healthcare.msu.edu.
Thank you.